In Chapter 19, Lesson 1, we're going to talk about the role of medicines. We can't have this whole discussion on drugs, alcohol, tobacco without discussing the drugs that many of us take on a day to day basis to help us feel better when we're sick, we're ill, whatever. And it's important to understand that there is a legal and helpful classification of drugs that we do determine and call medicines. I just want you to take about 30 seconds here for a minute and make a mental list or write down somewhere the different medicines that you know you've taken in your life, or maybe that you've taken in the last month or week, whatever it might be. Uh, I think most people will be surprised the number of different things that you might take for different ailments, illnesses, and whatever. So let's take a look at medicines and drugs. Medicines are drugs that are used to treat and prevent diseases or other conditions. Again, keywords being treat and prevent diseases, not just to make somebody feel good. That's where the definition of drugs can sometimes cloud this issue a little bit. Drugs are substances other than food that change the structure or function of the body or mind. So some drugs can have a mind altering or a psychoactive effect on the brain, which make a person feel good, which may give them reason to take that drug again. Doesn't mean it's a medicine, doesn't mean it's used to treat or prevent a disease. Sometimes it's just for that particular action. All medicines are drugs, but not all drugs are medicines. So you have to be careful when using both of those terms. There are four main categories of medicines that treat or prevent illnesses. We'll talk about all four, but here they are listed. In the red box, we have medicines that help prevent disease. In the purple box, medicines that fight pathogens. In the blue box, medicines that relieve pain and other symptoms. And in the last green box, medicines that manage chronic conditions, help maintain or restore health, and regulate body systems. Let's talk about the medicines that prevent disease. About 95% of children receive vaccines, which is a preparation that prevents a person from contracting a specific disease. A lot of people get the flu vaccine. Uh, that's a common one that people get every year. There's different strands of the flu out there, and every year the doctors and scientists get together and they come up with a vaccine that they think will be most effective against the what they predict to be the most common strains of the flu that particular season. Vaccines contain weakened or dead pathogens that cause the disease. When injected into the body, the vaccine produces antibodies that fight those pathogens. Antibodies are like blueprints to how to defeat the illness in your body. Your body creates memory cells that provide long lasting protection. So you remember how, and with that blueprint, with those antibodies, how to defeat that particular virus or pathogen or bacteria, whatever it might be, when it comes into your body again. Antitoxins help neutralize the effects of toxins as a result of bacterial infections. They fight bacteria and produce substances toxic to the body, and they also help produce antibodies. So again, we're just trying to fight off the invaders that come in. A little more on fighting the pathogens that come in. Again, medicines can also help your body fight pathogens that cause illness. Antibiotics are a class of drug that destroy disease-causing microorganisms called bacteria. Again, specifically for bacteria. Antibiotics such as penicillin work either by killing bacteria or preventing it from reproducing. Originally, antibiotics were considered miracle drugs because they saved so many lives. When they first were discovered, many people were able to fight off simple illnesses like strep throat and other bacterial infections. Can cause side effects like nausea and stomach pain, so some people react differently to them. Bacteria can develop a resistance to antibiotics if they are overused or the patient doesn't finish taking the full prescription. If a doctor prescribes you, let's say, 2 weeks of 2 pills a day, even after a week, if you feel better, you should still continue to take the medicine because it's designed over that length of time to be the most effective against that particular bacterial infection. We also have antivirals and antifungals, which are both different types of pathogens. We'll talk a little bit about in Unit 5. But antibiotics are only effective against bacteria, so they're not going to be effective against a viral or a fungal infection. They do not cure illnesses caused by viruses. Antivirals are available to treat some viral illnesses such as the flu. Antifungals suppress or kill fungus cells such as athlete's foot or ringworm, if you've seen commercials for Lamisil, or different athlete's foot medicines. That's a perfect example. In the category of relieving pain, these medicines are very, very common. And they're often called analgesics or pain relievers. They range from mild medicines such as aspirin to strong narcotics such as opium-based morphine and codeine, or what we often hear of nowadays is OxyContin. Used to relieve pain, reduce fever, fight inflammation or redness and swelling. Aspirin, acetaminophen, and ibuprofen are the most common. I would bet money most of you who are watching this slideshow have taken something like that in the past few days, weeks, months, whatever it might be, for something as simple as a headache, a sore body part, knee, ankle, especially after something athletic or you got injured. Aspirin can cause some stomach upset, dizziness, and ringing in the ears, and shouldn't be given to people under 20. When I was growing up, I associated everything I ever took with as aspirin, but looking back, I probably took Advil or Tylenol, which was never aspirin. It was either acetaminophen or ibuprofen. So again, we got to be aware of what we're taking and know what's on the label and be conscientious of what we're putting into our body. There is a risk of dependence when we take these different pain relievers. Certain types of pain relievers can be addictive, and some have some side effects that make a person feel good, relaxed, and maybe something that is a little bit desirable. Usually it's a narcotic, such as morphine or codeine, or certainly OxyContin, can become physically or psychologically dependent on them. Brett Favre, former Viking, former Green Bay Packer, was somebody who, back in 1996, when he was with the Packers, he had an ankle injury, I believe it was, and was taking Vicodin for that, prescribed from a doctor, and ended up getting addicted to it, started taking too much, had a seizure, ended up in the hospital, and the doctor said if he had continued doing that, he could have ended up dead. And right then and there, he decided that he was going to get treatment for that addiction, and he was able to stop his addiction to Vicodin. We also have drugs that manage chronic conditions, things that are long term. An allergy is something that's not just going to go away. And we have allergy medicines like antihistamines that reduce allergy symptoms such as sneezing, itching, or watery eyes, and a runny nose. Something that when it gets to be, too much, we want to be able to take something. An allergic reaction can lead to death, so it's nice to have these medicines to prevent us from, going in an anaphylactic shock and, somebody having their airway closed off and certainly preventing them from breathing. We also have body regulating medicines that are medicines that regulate body chemistry, such as insulin used by people with diabetes that regulates the amount of sugar in their blood. And we also have asthma sufferers who will use a medicine like an inhaler to control asthma symptoms when needed. We also have antidepressant, antipsychotic medicines. These are medicines that help people suffering from mental illnesses. You think back to Unit 2 and all the different mental disorders we talked about, there are some medicines that go in and kind of balance out the chemicals in the brain to allow a person to lead a more normal, healthy life. They regulate that brain chemistry and stabilize moods. For example, we have mood disorders, schizophrenia, and depression, all things where people can be prescribed medicine from a doctor to help kind of balance them out. We also have cancer treatment medicines, which would be a long-term potential life-saving type of medicine. Some cancers can be treated or even cured if caught early enough specifically. These medicines can reduce rapid cell growth and stop the spread of cancer cells. Things such as chemotherapy and radiation therapy. Talking about taking medicines, now many of you have taken a variety of different medicines and are probably well aware of the different methods in which we get these into our body, but it's important to understand that some are more effective than others depending on the illness. The method of use is going to be determined by what the medicine is and what it's used for and how it will most quickly and effectively help the person. If it's something we need immediately, we're not going to take a pill that's going to dissolve over several hours. We're going to probably inject it right into the bloodstream with a needle or syringe to try and get that medicine into the body as quickly as possible. The 4 ways to take medicines are pretty obvious. We have oral medicines taken by mouth, and that could be like a cough syrup or a pill. We have topical medicines, which can be applied to a skin. If you ever had, let's say, a bug bite and you put a little bit of ointment on it, that would certainly be topical. And there's other medicines used for that as well. Inhaled medicines delivered in a fine mist or powder an inhaler being the best example of that, and certainly injected medicines delivered through a shot. And everyone's had vaccines, or most people have, and the idea would be we have a vaccine for we have a lot for a lot of different diseases. It'd be great if we had them for some of the more dangerous and deadly ones. At one point, polio was a very deadly virus in our society, and I believe in the 1950s, Dr. Jonas Salk created a vaccine and essentially wiped off polio from the developed world where people have access to the medicine. There are reactions to medicines. If you ever watch a commercial and you see a new pill or medicine being advertised, a lot of times at the end of the commercial, they'll talk about the side effects, which often is a very long and lengthy list that sometimes makes you question whether or not you would ever even want to take the medicine. But side effects are reactions to medicine other than the one intended. And they can be mild, such as drowsiness, or maybe an upset stomach, dry mouth, things like that. That's nothing that's going to hurt or kill you, but others can be severe, and some even can cause death if it's really not meant for your body or your body type. When people are really sick, there might be more than one medicine being administered or involved, and we really got to be careful about the combinations of the drugs that are being used. Certainly a doctor or pharmacist would be the best person to design the medicine that a person should be taking, but sometimes we have over-the-counter medicines that we don't account for, and it certainly can cause a problem with a prescription drug that might be given to us. Combining two or more medicines can change the effect of some drugs. An additive interaction is where medicines work together in a positive way. My guess is somebody with cancer or HIV or AIDS who is on multiple different medications. The doctor or pharmacist knows how these medicines work, and often they're going to work better together and help that person feel better over the long term. There's a synergistic effect, which results in a greater effect than when each medicine is taken alone. This can be certainly sound good, but it can be dangerous where, let's say, somebody's already taking a medicine to help them sleep, so maybe a cough medicine with codeine, and now you have some alcohol with it, both being a depressant, and we certainly could depress the person's body so much that we could put them into a coma and possibly die. An antagonistic interaction is when the effect of one medicine is canceled or reduced when taken with another medicine. So let's use a depressant stimulant example again, where somebody is maybe taking some sort of drug with a stimulant, they drink it with alcohol. Now that the stimulant and the depressant effect kind of counterbalance each other, and maybe we don't get the effect of the drug that we're initially looking for. Anytime we're taking a drug, especially a strong one like a prescription drug, there's always a concern or a worry about tolerance and withdrawal. Tolerance is a condition in which the body becomes used to the effect of a medicine. So, for example, let's say I come home from school every day, I have a headache, I take 2 Advil or ibuprofen. Well, over the course of time, if this happens every day, and I keep taking 2 Advil, eventually my body's going to be so used to having those 2 Advil that 2 is not going to be enough. It's become used to that effect, so I'm going to maybe start taking 3, or over time it's going to be 4 or 5. Certainly people will up their own dosage, and that can be dangerous because now they're taking more than the label suggests. We want to, if something like that happens, we would call that a chronic condition. We would hope that somebody would go see a doctor, but we know that for small nagging problems like maybe a headache or some sort of injury, people will self-medicate themselves that way. The body requires increasing large doses to produce the same effect, like I suggested with the ibuprofen. And when a person stops taking a drug that they become addicted to, they could go through withdrawal. Again, it occurs when a person stops using a medicine that he or she has become physiologically dependent on, which could be both the body and or mind. Symptoms can include nervousness, insomnia, severe headaches, vomiting, chills, and cramps. Depending on the drug, when we get into more of the illegal, dangerous drugs, some of the withdrawal effects can even cause someone to be in such bad shape that they potentially could die.